Okay, so this is Mary, and I'm back with another episode of A Woman Full of Soul. And today I have with me Erica, who is an essential worker and also a relative. She's a cousin of mine, and she's going to start by talking about her everyday, her experience with COVID before today and now currently. So go ahead, Erica, go for it. What does your everyday look like right now?
Right now is a lot different than it used to be. I'm much more isolated now than I ever was before. But also in the past, I did live a little bit of an isolated life. But I work in a COVID ICU, so I pretty much, on my work days, I wake up, I get everything in order as far as my meals, exercising done, then I sleep and go to work. Upon leaving is when it gets a little bit tricky. I try not to come in contact with people. I don't like to go and see my family after my shifts are done. I don't have friends over. It's just been overall day-to-day much more isolated, and that's been the biggest change. Otherwise, kind of doing the same things. I limit my grocery store movements. I limit as much as I can. And I try to just focus on going to work and doing good for other people.
Okay, and so how long have you been an essential worker for? When did you start the essential that you can
Being
remember?
defined as an essential worker was since COVID outbroke, but I've been a registered nurse for almost 10 years. And I guess that's always been essential, even though I didn't really realize it. But it's so I guess just 10 years. Is that your question? I forgot. I'm sorry.
No, that's great. That's great. And where were you originally located when COVID first broke out?
So I've technically been doing travel nursing for the last 3 years, but when COVID first broke out, back in February, March, I was in Schenectady, New York, which was very close to my original home base, and I was working at a place called Ellis Hospital.
Okay.
Our COVID outbreak there was pretty significant initially, especially in the first, I would say, 2 to 4 weeks.
Yeah.
And it was especially significant because we started ending up having to take the patients that were overflowing from New York City. So we were getting notifications from ambulances just coming up kind of like in the middle of the night that they were on the way with a COVID patient because the emergency rooms, hospitals were completely filled down in New York.
Yeah.
And we were one of the next best facilities along with Albany Med and St. Peter's. So that was when it really started to get tough.
Yeah. What did COVID look like at that time for you as an essential worker?
It's funny. It started out a little slow. It started out with so I'm an ICU nurse. It started out with not a ton of ICU admissions necessarily coming in, but we got a lot of med-surg admissions that quickly deteriorated and became ICU patients. So initially it kind of started out slow, maybe for like the first week, and then it was just like we filled up the COVID ICU that we had designated, and then our main ICU started taking away beds and shutting off sections. Like day by day, we just kept filling and filling. So that's how that went.
Okay, and then how long were you there, and when did you have to go to another place? When were you rotated out to another space and place?
So our contracts are 13 weeks in general.
Okay.
And right before COVID, I had just started my contract right before the outbreak happened. So I was there at Ellis through the whole outbreak in New York, I would say. New York did such a good job of shutting down and limiting movements and mandating masks, promoting mask wearing, that our patient population of COVID decreased significantly by May. So
Yeah.
from May, June, July, our COVID population was minimal. It was still there. We still got them. We still had people recovering that had been there with the first huge waves that we had gotten, but it was much better. We had pretty much no new COVID admissions.
Right.
And everybody that came in suspecting of COVID ended up being negative and being able to carry on. So that was really good. I think New York did a great job. We shut it down. COVID dropped. And then my contract ended at Ellis in July, which was when Florida's COVID was spiking through the roof.
Right. Yeah. And so then you went to Florida, and tell us what it's like there now in Florida and what you've gone through. And even I want you to tell everybody what we talked about right before we started our interview about how you've had to like change your plans and flight stuff and hotel issues and all that. Go ahead.
Yeah, no problem.
I want you to make it clear to people what is really going on.
Right. So just for me personally, after the first wave of COVID back in New York, and it just being so overwhelming from the information coming from China from end of January to February, and people not paying attention to that, to the huge wave hitting and a lot of people dying and nurses falling ill in New York City. That was really overwhelming. And then just taking care of COVID, seeing a lot of death in a very short period of time, it was a lot. So my initial plan when I was done with my Ellis contract in July, in the first week of July, was to take the summer off.
I remember your post.
Yeah,
I remember your post. And I was like, we need nurses to go to blah, blah,
blah. Right.
And then within a couple of days, I saw you were going.
Finally, because I hadn't seen them since February. I hadn't seen any family since around the time of Super Bowl. Yeah. So I had been completely isolated, and I was like, okay, I'm going to just enjoy this time with my friends, my family, because also, obviously, my friends don't want to hang out with me.
Right.
I freaking COVID. Yeah. So, and they have parents, they have grandparents, everybody's at least conscious of that. So that was great, but at the same time, I wanted to be with them. But then I was leaving Ellis, and an opportunity had come up on my phone for a travel contract in Broward County. And I ended up just kind of sending out my resume just because, like, maybe they really need my help. They ended up calling me right away. Yeah. They asked me if I could be here in 48 hours, that they were so overwhelmed they needed nurses here right now. Mm-hmm. I didn't even need a Florida license initially to come down to help with their crisis. But that 3 months that I did, so July, August, and the beginning of September in Florida, was horrible. I saw more deaths in those 3 months than I did in pretty much my 9 years of nursing. And I've been doing critical care nursing for the last 6. So that's pretty significant. I've gone to multiple ICUs. I worked in a trauma ICU, and I've never seen as much death as I have in such a short period of time than I did with COVID. And don't really know exactly mentally how I've worked through that, but I'm continuing to, just because we have to. Like, I don't know what else. The worst thing about it has been the politics and society, the general population of society's response to the whole coronavirus outbreak. That it's a hoax, or don't wear a mask, it's not effective, or you only live once, so go and see people that you want and go and do things you want irregardless. It's been tough to manage. To see that to be on social media and see that is horrible. Yeah. Especially like in an hour I was going to work, and to have 3 people die, bed to bed to bed, just code, all dead. It was awful. That was one of the hardest parts, to not feel like you had the society's support behind you while you're going through all of this stuff. But yeah, so initially, and then Florida got better. I think that a lot of people started dying. Everything slowed down. People frequenting restaurants slowed down. Going out to clubs slowed down. Broward County and I believe Miami-Dade County ended up setting a curfew for sure. Yeah. I believe they mandated masks. At least every facility that I needed to go to had a mask mandate on their door.
I know eventually they put that in at first. When we were asking for people to go down, it was like all hell broke loose, and we saw it through the media, and I was like, you got to get people to Florida, you got to get nurses down there, you have to get the help down there. And on top of that, they were having the hurricane issues as well. So I
Right.
was like, you have to have no other choice but to get people down there. And so they did send, as you saw with yourself, people ended up going down there, but they didn't have everything in place yet to start restricting everything and cutting it down, right? Like making everything kind of
Right.
down. And just like you said, eventually it slowed down. They did the mask. They did the
Right.
mask stuff.
I don't like to talk a lot about politics, but I do know for sure because, I mean, we'd be at work watching CNN or Fox News or MSNBC, whatever the station was somebody decided to put on. The governor here from Florida refused to make the statewide mask mandate.
Yeah.
And I obviously came from New York, and we had, in my opinion, somebody who was making great decisions.
The total opposite.
So,
The total
right,
opposite.
literally like the opposite.
Yeah.
But the people that I worked with, the nurses and doctors that I worked with, claimed governor as their, claimed Cuomo as their governor, and wanted to put DeSantis in jail. And quite frankly, between him and Donald Trump, it should be a humane issue. It's almost like a genocide. It was horrible to have just dead body after dead body after dead body. Right away, we take them to the morgue and we get filled back up again. And we have these people on TV not promoting masks, actually saying you don't need to wear one if you don't want to. It was unbelievable. And it made me feel more comfortable, at least, that the healthcare providers that I was working with were so against what he was saying. And, they were going home and at least in their communities promoting mask wearing, promoting all this stuff. So the healthcare workers really tried to do as best they can with their part. But it's tough when you have a lot of people on the news, especially people in high-powered positions like the president and governors, telling you don't need to do certain things when clearly we do, one, and we have multiple infectious disease experts and scientists telling you that you need to and explaining the science behind it. But then the politicians thought that they knew more. I don't know what they thought, but it doesn't matter. What they promoted was wrong. It was awful. And a lot of people died because of it.
Yeah, so there was a point back in between, that space that you were talking. So we've done consultations throughout this whole time, and we've done consultations, as the foundation. We've done consultations with the world leaders, political leaders, including the ones in our government, and tried to help them to see a pathway forward. There was a point where we thought things would be lighter over the summer, but they weren't lighter because people in that region of the country didn't originally observe the mask wearing and all the other protocols that we did here in New York. If they had done that, then maybe the spikes happened that we saw in the South, or if the hurricanes hadn't hit, right, or the tornadoes, or the other tons of other things like the major protests. If all of that hadn't have happened and people weren't, gathered in a major space or having these major issues come up all at the same time, then I think maybe the spikes wouldn't have happened so much and we wouldn't have seen it so much. And then maybe not wearing masks would have been okay if those other things didn't happen. And if they had put in those practices way before, right? Like if they were actually observing that before, the numbers already would have been low and they wouldn't have spiked the way that they did. But since they didn't, it didn't work, right? Like it didn't.
Right. I think
Yeah.
one of the things too is like you don't even really need to be a scientist or be a healthcare provider, but if you watch movies and you watch
Yeah.
anything related to viral spread or bacteria being spread, they all need a host to live in.
Right.
So if you, I mean, obviously death would be a big thing to stop it,
Yeah.
but mainly like if the virus can't spread from host to host, then the virus dies.
Yeah.
So if we stop the spread, then we essentially obviously stop the virus. And I know that sounds so simple, but it's like people don't get it. It's like
Yeah.
we have to do all of the things necessary to stop the virus from being able to replicate in another person's body. And
Yeah.
it just, you know, and people twisted that. Like, and then some people didn't even believe it.
Yeah.
And then we had a
That was
president on
the
TV
other.
telling people not to worry about it. Meanwhile, over 200,000 people have died from it. So
Yeah.
it's tough to listen to everything.
Oh, definitely. And the safety precautions are really important. In the beginning up here, and I'm going to be completely clear because I know you've seen my posts on my page and everything else. In the beginning, when everything happened here in New York City, there was a point where I was like, I will wear a mask, but I will not wear a mask, wear a mask when I run, because if I do, I'll pass out, right? And so I made that clear. So everybody knew that I wouldn't wear a mask when I ran. And so I changed my running time to be super early in the morning, so nobody else was around me, right? So like 4 a.m.,
Right.
5 a.m., right? Nobody else was
Common
out there.
sense stuff. That's,
Yeah.
yeah, to me.
So, but anytime I went out and I was around people, I made sure to wear a mask. I did, of course, I did the hand washing, all the other normal protocols, the hand sanitizing, all of that. And I saw everything that happened here in New York. And then as we reopened, thinking in my mind that the rest of the country was doing the same protocols we were doing, because we've been told since God knows how long, right? I'm like, okay, well, I think the virus will decrease through the summer. But that wasn't the case, because we were one of the only states actually using all the safety precautions.
Right.
And then it comes out in May, oh, these people have decided they're not wearing masks. And so now all these spikes have happened, or they're not washing their hands, or I don't even, like, they're not social distancing.
Right. Well, they're screaming in people's faces.
Well, they're
with
yelling,
no mask
like
on.
even videos went viral about people like calling other people out in the store and telling them not to wear a mask. I saw a video where this one kid, like this young adult, had to carry out his grown-up father, right? Like a 45, 50-year-old man, out of the store because he was in somebody else's space yelling at him to not wear a mask. He's like, I'm not going to wear a mask. Don't wear a mask. What are you doing wearing a mask? And his own son had to carry him out. I was like,
Right. It's unbelievable.
it's
And I hope that person is well, but if that was their attitude and that continued to be their attitude, the chances of that person remaining well is unlikely.
It's very, yeah, it's very
so
unlikely.
You know,
And
I don't know.
yeah, and so I don't know how much, like the major leaders in our country actually knew what was going on in each state. That's one thing I will say. I don't know, because I know Trump was working through major crises, and I know that because we helped consult with major parts of the crises. Like anytime a natural disaster came up, we had to speak to the government about getting people there, getting supplies there, making sure they open extra places up so that people can be tested for COVID, getting the National Guard there. Like there were multiple things I had to advocate for each and every time. So myself doing that, I can't imagine what's going on in Trump's mind, literally, with each crisis that comes up on top of COVID. And I'm not here to like defend him at all or anything. I just know the way different politicians have responded, and I know specifically in certain ways what he was working through at that time. But I don't think anybody fully knew what each governor was doing or each politician was doing within their state, right? Until it came to light by the news, oh yeah, these people aren't wearing masks. They refused to mandate it. They refused to do this, or they refused to do that. Then we knew you're not even doing what people act like what you're supposed to be doing. You know,
unbelievable, isn't it? Unbelievable.
And the only way that they would believe that it actually worked, that masks actually worked, and I'm saying that because Cuomo is like head of the governors now, right? They and eventually elected him head of all the governors. So oversee,
That's
like,
great. Good
yeah,
news. I
to
can't wait for
oversee,
press.
yeah, to oversee the governor's, like, he's overseeing the governor's board because of the way he handled everything. But even in those moments, he kept saying, you need to have your people wear a mask. You need to have them social distance. You need to have them do this. This is the only way you're going to bring the numbers down. And then eventually
Right.
they finally listened to him and put it into place, and then the numbers dropped. But yeah, so I totally understand where you're coming from and your frustration, especially being there and seeing the people literally die each time. And I've seen your posts throughout this time too. You know, each time you had a hard night, you came home and you were like, you better wear your mask. I'm
Yeah,
like,
I mean, it's
you're like, that's
awful.
it. You're like, people pay attention. Listen to what I'm telling you. And still people didn't listen. I listened,
Oh,
other people
I've
did, but
gotten
other
horrible
people
things
didn't.
said to me.
Yeah. So I want you to tell everybody um how long you've been there now in Florida, and now, like, what does that look like? So you were telling me earlier that your hotel was paid for and the time frame on that, and now what's happening with that? Can you go into a little bit of that?
Right. So after a lot of people had died, a lot of the hospitals were overwhelmed for so long, the cases finally started dropping. And when they dropped, my company had, they obviously stopped paying for our hotel. They offered us a new contract at a lower rate of pay, which was fine. But I still had responsibilities in New York. So I had come to New York for about 3 weeks. I handled what I needed to. Um, and then I came back for my assignment. And
Erica,
I
I'm going to stop
recently,
you. Erica, I'm going to stop you just for 1 minute. So when you originally went to Florida, part of your contract was your hotel would be paid for, and what else would be paid for? Your car? Did you have a car? Would that be paid
no,
for?
but
No.
my flight, they paid for my
Your
flight
flight.
to come
Okay.
there, my flight to go back home.
Okay. All right. And so you were
And
there
then
for
the
the,
pay was significant. So that was
yeah.
good.
Yeah. And
I needed
that was like a 13-week thing? Another
That was
13?
a 13-week thing, but we ended up getting canceled about 2 weeks short of the 13 weeks.
Okay. And so now go ahead and finish saying what you were saying. Like there was a break, a 3.
Oh yeah, me personally, I just needed a 3-week break to come back home. I wasn't local to Florida,
Yeah.
obviously, so I had responsibilities back in New York I needed to come and handle. So I recently came back to Florida October 25th and started working at the same facility I was at in the same ICU I was at. But the COVID cases were not minimal, but much lower than they were when I had left. And within the last 2 weeks or so, we're starting to pick back up again. It's starting to become, it's starting to go back towards the crisis. So
Yeah.
our company started to negotiate our pay. They started to recruit more nurses because we don't
Good.
have enough nurses as it is right now. Even
Yeah.
with myself and others that have traveled here, we don't have enough. So they're recruiting more and more every single week as the numbers continue to rise. And we're rising. And this is before the holidays.
Yeah. Well, so I'm happy. I'm not happy about hearing that it's rising, but I am happy to hear that they are recruiting, because I've been saying that for the last 3 days. At least 3 days. You need to recruit more people, because I'm, trained to watch the map. Okay. And to be
It's
like, you need to,
amazing.
yeah.
Your
And like,
job is amazing.
you need to actually get there, and you need to get them there now, because, and this is even before the holiday, right? Imagine after all the people fly,
Oh,
right?
I don't even know. Yeah,
Or if
I'm
they're with their
nervous.
family, or all the other things. And it's yeah,
Yeah,
but
I'm scared
I'm scared too, but
every day.
I'm glad to hear that they're recruiting, because the whole nation right now, and I've said this, they all need to be recruiting right now. And not
Right.
just
And I work for a really good
yeah,
company who seems to be extremely proactive in that, and that they really value the care that we provide and then the danger that we face being there as well.
okay.
So they've been very good to us, and I look forward to more people coming in. We really need they need a lot more people. And I only work for one hospital system down here. There's so many, and they're all filling up again with COVID.
Yeah. Well, yeah, and that's the reality across the United States. Almost the whole map right now is moving into dark purple. Dark purple is the next to last phase for the black. Okay. I can't emphasize that enough. Up here in the Northeast area, it's not dark purple yet, but the hues are changing to that color. So it's not something to be la-di-da about or take really lightly at this
No.
time at all. And I'm saying, I know you know this, but for everybody else, I'm saying that as a mother who has two children, and I've been away from my own children for 6 weeks, dealing with the issues and trying to overcome them and trying to come up with solutions, right, for the whole country and internationally to have the pandemic solved, right?
Right.
So even the recruiting process for nurses now to help with um, the overflow at the hospitals or the ICU as they slowly fill up, and there will be an overflow, right? There will be if people don't actually observe what
One of the
people have
things I
said.
didn't mention to you is we started out as an 18-bed ICU, and then
Yeah,
there was a unit across the hall that we ended up needing to clear out and open that as our second ICU.
yeah,
They had no ICU supplies. We had to make ICUs, like where the monitors were on the tables, and it was like a war zone. It was
yeah,
terrible, and that was here in Florida, where
yeah.
I think it's similar to New York, because upstate New York, I feel like it's very similar to mid Florida, where people they have whatever views they have, but they don't really acknowledge the suffering unless it's happening to them, and they can't really grasp the concept of needing to limit certain pleasures in their life in order to save the lives of others. It might not be themselves, but it has to do with other people, and it's concerning. So until people break that cycle and or we get a vaccine, COVID's not going anywhere, and we are going to continue to see these spikes and drops in cases as people learn and continue to go. And it's sad.
How do you feel about the vaccine coming out and what you think that looks like so far?
Okay, so
This is a loaded question,
this
I
is
know,
so tough. This is the
but
toughest question for me
I know.
because I don't know enough. Okay, the vaccine itself, the whole talk of the vaccine is fantastic. Vaccinations have been obviously one of the greatest discoveries in science and healthcare to prevent illness and prevent disease. That's wonderful. However, as a healthcare worker,
Uh-oh, you
and
froze.
I know of my colleagues, we are concerned. We are concerned about us being mandated to receive the first vaccines that come out.
Oh, why?
And the reason we are concerned is, one, it's a new drug. We don't fully know. No, we not fully know. I'm saying I don't fully know.
Okay.
I'm sure that the FDA, the people making the vaccine, have done extensive studies. But for us receiving it, we can hear that, we can be told that that's what's done. But to be the first part of the general population that gets it as a healthcare worker, we're concerned. We're scared
Yeah, it's
to
scary.
receive anything new. If of course, like,
Yeah.
we should be a little concerned, especially we know side effects of drugs. Drugs can affect anybody, anyway, in any different way. You never really fully know somebody's exact response to something. That's concerning. Another big thing for myself personally, and I've heard from a few other people I work with, is we have been working not safely. It's been scary, but relatively safely without contracting COVID. Like, we've been working doing that this whole time without contracting COVID. And now we're going to be mandated to get this vaccine, and we're just not sure. I don't really, this is what I was telling you I might ramble about.
That's okay.
It's just scary to be the first of getting something.
Yeah.
And I don't know if it should be more scary or if we should feel more privileged. That was another thing. Like,
Yeah, it's
are
true.
we
Yeah.
privileged? Are we privileged to get this vaccine first? Are they going to give it out to healthcare workers as a sort of privilege? Not a privilege. I don't want to say that because that makes it seem like we're putting down other people, but we're not. why are healthcare workers having to get it first when we
Yeah.
still have to wear our N95s, we still have to wear our face shields, we still have to gown and glove and do all of the safety things? Why us first?
Yeah, so I think what
I don't
their
think I'm.
reasoning, yeah, what their reasoning is behind that, if they end up going that way, but it's open to interpretation right now. But if they, yeah, they're even today during the briefing that they had, it was still like, well, we're coming up with our recommendations. This is what we've said in the past. We're thinking essential workers. Um,
It
their
concerns me
thought,
it's mandated also.
yeah,
Mandate is like a oof.
I think they're, yeah, mandated is tricky. I don't know about the mandation part, but I think their thought is with having it go to essential workers first, it's safety for the essential workers so that they can continue doing their jobs, and they don't, like, it's a pretty much a guarantee they won't contract COVID, and they can also be there and present to help with COVID cases and or help to administer the vaccine to other people. That's what I think
Right,
is the reason behind it. And because there,
right,
I know your privilege question, I'll go back to that in a minute, but there's also this area where essential workers have been jeopardizing their lives this whole time, every single day they've been working in these roles. Every single day they've been taking care of a patient. They have been jeopardizing their own lives, their own health, their own safety, and putting themselves on the line. Hilarious. Church is calling me right now. So it's like one of the major people that I contact, yeah, that I'm in contact with, but they can wait. So it's this major, they've been jeopardizing their lives this whole time and putting their lives on the line every single day, working with COVID patients every single day, trying to save lives. They should be one of the first groups to be saved. And I don't mean saved, I mean like to have that extra precaution, right? That they won't get the virus as they continue to do this work or as they continue to help with the hospitals. Because the thing is, we're going to see, I know we're going to see all the cases spike. They're going to spike. So not only are we going to have COVID cases spike, we're also going to have to administer the vaccine at the same time. And the hospitals will probably be full. Some of them are already full of COVID patients. So then what are you going to do? How are you going to use the staff? You know, what are the essential workers going to have to do at that time? And how, if they're not vaccinated, are they going to be able to do what they're doing? Right? Or do multiple roles in different areas because there isn't enough staff to go around. That's the other, like if we can't continue, like we're recruiting, say we don't get enough people recruited, say we don't get enough nurses recruited. What if like half the day nurses have to be, I'm like really playing devil's advocate here. You're gonna be like, holy, but like this better not even
no,
happen.
it's fine.
My thought is like, what are we gonna do if we don't get enough recruited nurses or whoever to administer this vaccine? Are we gonna have nurses like yourself who work in COVID with ICU, then like work half I don't know, half the day in ICU and then half the day administering vaccine? What, what is this really going to look like? Because
I know.
you're already stretched so thin. There are not enough nurses to go around already. Like we were
Right.
just talking about earlier, the numbers are climbing and yes, they're recruiting, but we saw back in, the beginning when everything got crazy, how there weren't enough nurses here in New York and we had to recruit in. We had to open up the convention center to make sure we had a place for overflow. It's a major, yeah, it's a major thing. So I think their thought process is essential workers deserve this vaccine because of all that they've gone
That's
through
good to know.
this whole thing, through
Yeah, and
this
I
whole
look
time.
forward to a vaccine. I'm not an anti-vaxxer. I
Yeah.
don't feel that the FDA and that like the pharmaceutical companies will necessarily like intentionally harm anybody. I don't believe that. But I just it's yeah. I
Yeah.
think we should just be a little cautious on
Well,
that. And then my biggest concern too is a lot of the things that I've read, not everything, and I haven't read anything within the last week, But prior to that, I was reading things about the vaccines going out and about people receiving it and
Mm-hmm.
what their symptoms were like. And a lot of people felt flu-like symptoms for 3 to 5 days after they received the vaccine. Some people didn't feel anything. A lot of people just felt muscle soreness, as with the flu vaccine.
Yeah.
But if all of us are feeling flu-like symptoms for 4 to 5 days, and even, who's going to work that week in the
I know.
healthcare?
You're like, who's gonna work with all the patients, dude? If that's the case,
If
yeah.
we're all feeling sick. So it's like I'm definitely excited for a vaccine. I'm excited for a safe vaccine. I'm excited for a safe rollout and a safe and effective rollout and administration of the vaccine. I'm sure that I will be one of the people getting it and receiving it. So I look forward to it. I look forward to society being able to go back safely to the more normal things that we always had. But
Yeah.
I guess we'll see. But
Yeah,
it's nerve-wracking. I think it should be for anybody.
of course. Yeah, and
Especially.
so the percentage right now is 95%, 95% effective, and the side effects are some that you have listed, which is one reason why it's ready to go through FDA approval.
Mm-hmm.
But I flat out know, because I know people who don't vaccinate their children. I know there are people who are going to be like, I'm not doing this vaccine. I'm not doing it.
Of course.
There
yeah,
will be
we're gonna
people
have a
who are
lot.
like, I'm not doing it. So if it's mandatory vaccine, I don't know what that's going to look like. I have no idea. I don't know.
I don't think right. I don't know how they would roll it out for the general population, but I know for hospitals and working for private facilities, they can definitely tell you if you don't get the vaccine, you're not able to work here, or
Okay.
if you don't get the vaccine, you're not able to come. I think that. I mean, I don't know. I shouldn't say that out loud, but I think it's possible that they'll be able to do that.
Okay.
I hope
And
not.
so the other thing that came up in today's conversation, and this was broadcasted, like at least domestically, if not internationally, whatever. But one of the things that came up is, who are the vulnerable populations and what do they look like? Is it the essential workers? Is it the Black and brown communities? Is it youth? Is it people in nursing homes? There's that whole question too. So that's why nothing's decided yet. The government boards are still looking into, and the scientific boards are still looking into who they're going to recommend as the first group.
Right. One of the most horrible things, I think, is that we don't know who's the most vulnerable populations, specifically because so many people have suffered so much from COVID, and so a lot of the suffering has been indirectly related to COVID. So I think, from my opinion, from what I've seen personally and in my practice, is people from the age of 40 to 70, 40 and up, I would just say 40 and older, are at an extremely high risk for having the horrible effects of COVID. But then, even though maybe young children aren't getting as sick as frequently as older adults, younger children are suffering in a sense of school. And then I always think of people that don't have enough money and relied on school lunches and meals coming from school to be able to feed their kids. That's another form of suffering. The children that always had school as a safe outlet to go to, being abused at home and not having the safe outlet to go to, and not having an advocate like a teacher or a principal say, hey, this child is showing signs of abuse, we need to intervene. They're suffering across the whole board. And some of it's directly related to COVID, as far as the effects of COVID directly on the human body, and other things are related to the need and the need for shutdowns and the need for slowing down movements across the United States. I feel bad for people's businesses. That's people's livelihoods. That affects mental health. That affects the way they can care for their families and and take care of their homes. It goes everywhere without saying that COVID has affected every age group in some sort of way.
Yeah.
Sad.
If you could give words of hope to, and this isn't one of my interview questions,
That's okay.
if you could give words of hope to everyone, and I'm asking you this because you're an ICU nurse who has dealt with tons and tons and tons of patients. You've seen, I'm assuming you've seen some survive, right? And then you've also seen some patients die. Like all the patients haven't died, right? But give me hope in that area.
Um, most have died. I just, before I continue answering that question, our ICU has had a 96% mortality rate, meaning 96% of our patients did die.
Okay.
So yes, I
So,
saw some survive. It was very few
okay. So my
for
question
me.
to you is now, what are 3 recommendations you would give to everyone? First, that's my first question. What are 3 recommendations you would give to everyone right now?
One, if you don't like politics, you don't like the media, you don't like to listen to CNN or Fox News or any of that, listen to your local healthcare providers, listen to scientists. I I don't I don't fully recommend people doing all of their own research, only because people don't seem to frequent the credible sources, and then they get overwhelmed with ambiguous information that doesn't make sense. So literally listen to your local healthcare providers, listen to your local doctors, listen to your local nurses, listen to, if you know somebody with a science degree, biology degree, infectious disease, who is specialized in that, listen to them, follow what they say, follow the warnings. If they're telling you it's really bad, it really is. We're not making it up. We have no gain in the whole thing other than to slow the spread and stop the overwhelming of the hospitals, because we
Right.
can't provide the care that you need. We don't have
Right.
the supplies that we need to stay safe and that we need to provide to you. Just listen to your local people, please. Anything.
Okay, so that's your number 1. What's your number 2? What's the second thing you would tell everybody?
Actually do what they're telling you. Like, listen to them, then actually take into action what they're telling you. If people are telling you, like, please don't go around family, or don't have large family gatherings. If something like a large family gathering is important to you, then what's the next thing? What the next thing was to quarantine. The next thing was to quarantine for up to 14 days. Make sure you don't have symptoms. Make sure you don't feel sick. Don't be around anybody that's strange to you, not normal to your household, and do that for 14 days, and then it's a lot safer to go around your family members. And if you can't do that, then at least everywhere you go, wear a mask. And if there's no reason not to wear a mask when you go out in public and be around other people, it's very simple, very easy. So there's no excuse for that.
Yeah.
But and if you're really set on seeing your family, see them in an outside setting, separated from one another while wearing masks. You don't want to trust me, like, I've taken care of these people who have gotten their fathers, their grandmothers, their mothers sick, literally, like, talking to their family on the phone. The amount of guilt that they feel is unbelievable. Don't let yourself be one of those people. Just be safe. Move carefully.
What's
That's
the
that.
third thing you would say to everybody?
Just continue loving and supporting one another, because this is hard for everybody. This is not one single person in life right now is really, like, just breezing through easily. So just continue to be kind, be compassionate, be loving, and don't be selfish. Think of other people, even if your community, if you live in a small community or whatever, hasn't been affected. Just know that there's so many other communities across the whole United States that have been, and so many people are dying, that you're not the only one, and do what you can to prevent the spread.
What's one thing you would say to give hope to other people right now?
It's gonna be over. This, it's
You're
gonna
like,
end
it's
one
gonna
way or
be
the
over.
other. So yeah, I mean, like, not this is gonna be over. Like, the world will probably still live, but it's about how many of us are gonna be here to enjoy it. So, stay tough right now. Stay strong right now, and this is only temporary, as long as we continue to take the action that we need to, and listen to that. but it's only temporary. We're going to get through it. We're getting through it. It's been 8 months. We're on our way.
Yeah. And I'll speak to that too, because even maybe at the beginning of this week or the end of last week, you know, because I'm dealing with the people that I'm dealing with and helping them with these major things, there's a point where my whole system is just like, no more. And I know you've had these days. In ICU, there's no, you haven't had these days where you're just like, I'm done. No more. I'm done. Done. I'm done. No more. I refuse to take any more on. I refuse to help anymore. I refuse to talk to you anymore.
You saying that makes me tear up because literally.
So true. I know you've gone through this because I've gone through it. Like this is maybe my second time, right? And usually it's when I'm away from my family for a long time and I've had to help with major things and come up with major solutions, right? So I would say like at the end of last week, I was like, okay, you guys are all on your own. I'm done. Right. So, but it is the point of having that hope and knowing, like, and I would say even right after I gave all my recommendations and I said, this is what you need to do. And I didn't see it happening for a couple of days. And then I said it again. And then eventually I was like, this is exhausting me. And I was literally exhausted going to, you know, by 4 p.m. Right. Exhausted.
Right. Done. Yeah.
I'm like done. And my whole body is telling you no right now. But once that happened, it clicked for them and they got it and they moved forward on FDA approval for the vaccine, right? Or they got it and they started implementing the things for distribution and administration, or the UN, like even yesterday, the UN just finally had their major meeting with over 350 different groups and organizations to start figuring out the plan for the international distribution and administration of the vaccine. You know, but
that's incredible.
It takes that moment of being like, okay, I'm done. Now, where is the hope? And what do I turn to? So that's one reason why I asked you, then your words of saying, we're getting there. We're working through this. We are moving through this. It will not last forever. All of those are true. And every single person that's been working on this, right, and focusing on this, or even pivoting their jobs. So like even in the arts where they've had to pivot and go live streams so that they don't expose people to concerts or the virus in concerts, right? It's not
right. Yeah.
You know what I mean?
The AMAs just happened. That was fantastic.
Yeah, like making that all live streams so that people actually live, right? We want
the last
thing
to live. Yeah. Sorry to interrupt you. I do want to say we are smarter than this virus. We as humans are smarter than this virus. We can get through this. We can get around this. We can enjoy the things that we've always enjoyed by getting around this together, but we can't do it with all of the separate forces and people arguing with one another over things that aren't real. Like we need to focus on what's real, get through it, work together, and
overcome
it. To move on.
Yeah, and overcome. That's the only way you can overcome. That's the point too. The unity and not division is the only way to overcome it. And actually taking seriously the recommendations that are made, right? Because if you don't, again, there's an overflow in the hospitals if you don't. And there's not enough people to work in them.
Right. Not enough supplies to care for the people in the hospital.
Or they may actually end up getting sick themselves because now they're in that position. Like you haven't, of course, and other people haven't. But some nurses have.
I'm scared every day.
Yeah. So using caution and really listening and taking, like you said, the 3 recommendations that you said, they're all very, very important. And things would drastically change if people actually did those things. I agree.
Yeah. This is great.